Formaldehyde is the most commonly used fixative in histopathological studies. Shelf life of blood with acid citrate dextrose is 21 days. ESR is decreased in polycythemia, sickle cell anemia, hereditary spherocytosis, and congestive heart failure. Insulin resistance is seen in hepatic steatosis, which occurs in non-alcoholic fatty liver disease. Membranous glomerulonephritis is associated with malignancy. Lymphatic spread is seen most commonly in papillary thyroid carcinoma. In Langerhans cell histiocytosis, the characteristic abnormality is Burbick's granules. Microcephaly, holoprosencephaly, and thinning of corpus callosum are sequelae of fetal alcoholic syndrome. In monomorphic ventricular tachycardia, DC cardioversion is given if patient is unstable and amiodarone if stable. A 20-year-old female has headache, vomiting, and decrease of movement of right leg. In past, she had episodes of violent and aggressive behavior and abdominal pain. Diagnosis is acute intermittent porphyria. Aneurysm is the anterior communicating artery, leads to bitemporal hemianopia. Aneurysm of posterior cerebral artery leads to compression of cranial nerve 3 and presents as ptosis, dilated pupil, and pupil down and out. Key enzyme in glycogenolysis is glycogen phosphorylase. Phosphofructokinase is the rate-limiting enzyme in glycolysis. Chest X-ray in TPE shows increased bronchovascular markings, diffuse miliary lesions, or mottled opacities. It presents as nocturnal cough and wheezing. TPE is topical pulmonary eosinophilia. Inclusions in giant cells in sarcoidosis are Schaumann bodies, asteroid bodies, and residual bodies. Bilateral hilar lymphadenopathy is a hallmark of this disease. Digeorge syndrome is characterized by absence of thymus. Pregnant female with heart disease will have engorged neck veins. Isoprenaline is avoided in tetralogy of Fallot. Band-shaped keratopathy is seen in chronic uveitis. A 35-year-old pregnant female complained of hearing loss. She was sent for tympanometry. Type A tympanogram is seen is diagnostic of otosclerosis. Continuous positive airway pressure is most common treatment for obstructive sleep apnea. Supraspinatus, infraspinatus, and teres minor attached to the greater tuberosity tubercle of humerus. Golgi tendon organ is used to detect tension in the muscle. Pre-Botzinger complex is responsible for rhythm generation of inspiration. Dihydroepiandrosterone is produced by adrenal gland and it produces estrogen and progesterone.